Hi, everybody. Lovely to see you all. I don't know how many of you have an elderly parent, or maybe some of you are carers, but I've been a physio for 40 years and I've run Physio on the River for almost 28, coming this spring. And I've seen a lot of people in their older years over the years, and I've treated people who've not fallen but feel that they might fall, and I've treated people that have fallen and trying to prevent them from falling again. So today I'm going to talk to you about that, and I'm going to share my screen with you and take you through some slides. Just bear with me for a second while I bring it up. Oopsie. There we go. Right, hope you can all see that. So let's move on. So what are the facts and figures about falls in the UK? So 1 in every 4 older adults are thought to have a fall each year. That's quite a lot when you think of the number of older people that you might know. That's quite a high percentage. An older adult falls every second of every day.
What you do? I think someone there.
Frequent thing. The percentage of people reporting a fall increases with age. Well, you might think that's not very surprising,
Water do.
and it isn't, but it's worth noting. And falls are the main reason older people lose their independence. I think that's a really important fact. It's often a turning point. If someone has a fall, it's often a turning point, and it can be a bit of a downward spiral in their general health after a fall. So we want to try and get in there before they fall, if we possibly can, and try to prevent it. And then people who've fallen once are more likely to fall again. So what causes older people to fall? Well, as I just said, if you've fallen once, you're more likely to fall again. So simply having a fall makes you more susceptible to falls. A loss of muscle strength. So from about the age of 40, our soft tissues begin to change and they lose their elasticity. And we generally get a little bit stiffer as we get older. On top of that, lots of older people suffer from arthritis, and arthritis is a disease of the cartilage of the joint, and it causes your joint to become stiff and for you to lose range of movement in your joint. And the disease process in that joint also causes the muscles surrounding the joint to become weaker and for you to lose muscle bulk or muscle mass. So that loss of muscle strength, we know that from the age of 40, we lose about 2% of our muscle mass, which is about 1% of our muscle strength every year thereafter. So if you, that may not sound very much, but if you think about it, if you live to 80, by the time you're 80, you might have lost 40% of your muscle strength. Now that can be reversed if you're working to combat that. If you're exercising regularly, then you can prevent that. But if you're not an exerciser, then that's what's going to happen as you get older. So it's a very important factor, and it's why people generally get more frail as they get older. Loss of flexibility, as I say, if you've got arthritis, then you often lose range of movement. So for example, if you've had knee arthritis, then your quadriceps muscle, the muscle at the front of your thigh, often gets weak. The buttock muscles often get weak. And those are two big muscle groups that are important in standing up from sitting, walking, climbing stairs, all those everyday activities that we take for granted. Poor general health, we know, can lead to people having a fall. So again, if you're in poor general health, then generally speaking, you're probably not as active as you could be. And if you're not as active as you could be, then your muscles are going to waste and you're going to become less strong, and that may lead to a fall. Deteriorating eyesight. So as people get older, generally speaking, their eyesight is not quite so good, and they might not be quite so good at having their eyes checked, and that can lead to a fall. There are lots of causes of dizziness. just to mention a few, blood pressure, low blood pressure can cause dizziness when someone gets up quickly. Your balance organ is part of your inner ear, and that, if you have a problem with your ear, then that can cause you to become dizzy or to lose balance. So if someone complains of dizziness and they haven't had a fall, it's a really good idea to try and check that out with their GP and get to the bottom of the reason for it. Some medications can also cause a loss of balance, the side effects of some medications. And then, as I mentioned before, a lack of regular exercise and mobility. And of course, there are some people who stay exercising all the way through their lives, but generally speaking, as people get older, they do exercise a little less. And then a loss of confidence. Now, of course, if you're not feeling very steady, then that leads you to feel less confident. And if you haven't got as much confidence, then you don't go out and exercise as much, and then that causes more of a loss of confidence. So it's a vicious cycle. But it's important to note that falls aren't just a normal part of getting older. They are preventable. Most of them are preventable. And screening and finding effective strategies to help people can help save lives and also save money, because anybody who has a fall who ends up in hospital costs the NHS a lot of money. So how can you recognise the onset of frailty and the likelihood of falling? So if you have an elderly relative or a friend or a neighbour, or you are a carer, then these are the sorts of things that it's worth looking out for. When an older person says that they feel unsteady, that's often the first sign, and it's worth really listening and taking note of that and taking it seriously, because if you can catch somebody at that very early stage, you can prevent them having a fall. Noticing your relative holding onto the furniture as they move around a room, that's a typical thing that we see. Again, another alarm bell should be ringing. Difficulty getting out of a chair, that again signifies weakness, usually in the legs and the buttock muscles. You might notice that they're having trouble getting up and down off a curb or a step. Or they might become a little bit more dependent on holding onto your arm when you're going out for a walk with them. They might be recovering from illness or operation. As I said, if somebody's been ill, then often they get weaker, and they'll be more susceptible to a fall after an illness. Or if they've had a spell in hospital, they often, I'm afraid, come out of hospital weaker than when they went in. They might be better from the condition they were being treated for, but they often lose muscle power and strength. So how can a physiotherapy assessment help someone? Well, first of all, we ask a lot of questions. We want to know about their general health, their history of falling. They've fallen before, we want to know that, because then we know that that makes them more susceptible to falling again. Their general medical health, as I mentioned before, your general medical health has an impact on whether you're likely to fall or not, how frail you are. The medication you're on, and we want to know what's been the trigger. You know, has it been an illness, or has it just been a slow, gradual process? We might visit the person at home. There's nothing like being in somebody's own environment to spot the things that might be tricky and might cause a hazard to them, and might cause them to fall. So what will we look for, you might ask? Well, first of all, we assess the patient's functional abilities. So by that I mean, we might look to see, you know, can they sit up from lying down unaided? Can they go from sitting to standing unaided? Can they climb stairs? Are they able to move about the house without the need for an aid, like walking aid, like a stick or a crutch? I might look at them outside if they go shopping and that kind of thing. I want to see how they are on the street, on the pavement, because pavements are a bit different from indoors. So we look at all those everyday activities that people do and how they function. I'll also look at the way that person walks. Do they limp? Are they, are they unsteady? Do they need a walking aid? Older people tend to be quite reluctant to take on a walking stick. They sort of feel it's a sign of aging, but actually it can be, it can give you freedom. It can allow you to go out when you weren't before. So I try to sell that aspect of it. I test their muscle power in their arms and their legs. You need strength in your arms to push up from a chair, that kind of thing. So it's just as it's important as well as leg strength. I look at their range of movement in all their joints to see whether they might have lost movement. If someone's had a knee arthritis, for example, they often lose the ability to straighten their knee fully. And that's really important when you're walking. Or if you've lost movement in your hip, that can make it difficult getting from a seated position to a standing position. And I test their balance. So a little bit tongue-in-cheek here. So the bottom right, I wouldn't be getting somebody to stand on a wobble board, but or a bozu, but you get the general idea. We look at balance, flexibility, strength, and how they walk. And how can I make a difference? Well, once I've done my assessment, I can see where their deficits are, where their weaknesses are, and I can create a tailor-made exercise program to address each of those aspects. But to be honest, very often it's a combination of things. They nearly always have some loss of muscle strength. And if you're weak, then your balance is likely to be not so good. If you've got a stiff joint, then your balance is likely to be not so good. So it's usually a combination of things. And so the exercises address each of those aspects. They might require a walking aid, and it's not just a matter of giving somebody a stick or a crutch. It's actually getting them in and getting them to practice inside, practice outside. It's a skill, just like any other skill, and you can train it up, you can improve with practice. So we give them lots of hints and tips and get them to practice walking up and down, walking around objects, maneuvering up and down steps. So all of those things are important. And sometimes I even help go through getting up from the floor, because a lot of people are frightened of falling, and part of that fear is not being able to get up. So I often go through ways that they can find to get up should they fall. As I was saying, I sometimes take people outside. We're right by Barnesbridge Station, so the station steps are a great place to practice. And what else can be done? What perhaps could you do? So we know that early intervention is absolutely essential. Prevention is better than cure. If we can stop somebody having that first fall, we know that it becomes more likely they'll have another once they've had one. Report to their GP as soon as they start to feel unsteady, because they can be helped. The GP can often organise a visit from an occupational therapist or a physiotherapist, and they can look at the person's situation at home, whether they need grab rails in the bathroom or a grab rail at the front door to get up their porch. All those sorts of things can be assessed. Probably my most important message is that keeping moving is absolutely crucial to maintaining independence. And that old adage, move it or lose it, is so true. I've got patients of mine in their 80s who still go to the gym, and it's really important that as we get older that we continue to exercise and we don't let that fall away, because it is incredibly important. Regular eyesight checks are going to be vital, and home safety. So if it's an elderly parent that you might be concerned about, go to their house and look at the common routes through their house that they might take. So from the bedroom to the bathroom, from the bedroom to the kitchen or sitting room, and put on a new set of eyes and check that there's nothing that they could trip up on. No rug with a little edge that they might trip on, piles of magazines. Make sure it's clutter-free. Incidental tables, they look lovely, but they're not always so good. Very often they can be a hazard. So just make sure that the place that they live in is clutter-free, and they've got easy access from one room to another without any hazards. Footwear is also important. I know a lot of people like to wear slippers indoors, but as you get older, slippers really don't give your feet very much support. The heel cup at the back of the shoe doesn't really grip the back of your heel, so they aren't really suitable. I think every older person should have a really good pair of trainers. I know a lot of older people can't bear the thought of that, but actually they you know, a proper pair of laced up trainers can be very supportive, and they're very cushioned, they've got good grip, and they're going to help you and stop you from shuffling about.
Yeah.
So my take home messages tonight are: it's never too late to strengthen your muscles, whatever your age. It's, you know, anybody can do exercises that will help them get stronger. Prevention is better than cure. You want to prevent that first fall. So recognizing the signs early on is really vital. Most falls are preventable. Keeping fit and active, if you possibly can, from about the age of 40 onwards, or earlier if possible, is really important, right into old age. Trying to address all different types of fitness. You know, I know a lot of people, older people, like to walk, which is a great form of exercise. But you also need to remember that walking doesn't stretch your joints in all directions. So working on mobility and doing some light weights for strength or resistance, using resistance bands, are going to help with strength, mobility. Also doing some exercises for balance are going to help. Walking isn't really enough. Walking will help your stamina, and it's very good for your heart, but it doesn't address all the aspects of fitness that you need. So trying to get a little bit of everything is a really good idea. And then watching for those early signs of unsteadiness or loss of confidence. If you're a carer or a relative, that's a really important thing. So we can be found at Physio on the River. We're in the old ticket office of Barnesbridge Station, and my contact details are there. And thank you very much for listening.